Common cold, understand it to prevent and treat it effectively. Hi. The common cold is a common disease caused by viral infection, usually through the respiratory tract, rhinoviruses, or through the gastrointestinal tract or contact, enterovirus, etc. The common cold affects millions of people globally to varying degrees, at every moment. Although it is common, the common cold seems like a small, trivial disease, but it can have a great impact on the ability to function and work, on the mental state as well as on the rhythm of daily life and work. Yet, questions like why does the common cold happen? What are the symptoms of the common cold? How to prevent and treat? And especially are antibiotics used to treat the common cold, etc., is still unclear and even confusing for many people. Hopefully, this brief talk will partly clarify those extremely important issues for you. First of all, let's talk about the cause of the common cold. As mentioned above, the common cold occurs due to viral infection, usually through the respiratory or gastrointestinal tract through the mouth, such as rhinoviruses, adenovirus, enterovirus, and some other virus strains. They are often the cause of the onset of common cold. The common cold is very easy to spread from person to person because of the contagious nature of the viruses it causes. The above viruses have the ability to spread in the environment through airborne droplets, sneezing, coughing, or contact with virus-contaminated surfaces and objects. So, how can we recognize the common cold? Symptoms of the common cold. When suffering from the common cold, the patient will usually have symptoms within 1 to 3 days after exposure to the virus that causes the disease. Common cold symptoms include runny or stuffy nose, sneezing, cough, sore throat, watery eyes, fatigue, and mild body aches. However, although uncomfortable and interfering with work and daily activities, these symptoms are usually milder than those associated with flu. And now, the question is, how can we prevent the common cold? Preventing the common cold. To minimize the risk of getting the common cold, we need to apply good hygiene measures and minimize the risk of being infected with the virus that causes the disease. Below are some measures that seem very simple but are very effective in preventing the common cold. 1. Hand hygiene. Regularly wash your hands with soap and water for at least 20 seconds, especially after coughing, sneezing, going to the toilet, or before meals. 2. Frequently disinfect your hands in the workplace, especially in high-risk areas such as hospitals, healthcare centers, etc. When soap and water are not available, use a hand sanitizer containing alcohol to remove viruses on hands, fast and convenient. 3. Avoid touching your face. Many people have a very unhealthy habit of frequently touching their face. Be careful to break that habit. In particular, you must limit touching your eyes, nose, and mouth with unwashed hands to reduce the risk of virus infection. 4. Respiratory hygiene. A seemingly simple but very effective thing to prevent the spread of disease-causing viruses is to cover your mouth with your elbow every time you cough, or use a tissue to cover your mouth and throw the tissue away properly. Then, wash your hands immediately before touching any other objects. 5. Clean objects and living space. Pay attention to cleaning and disinfecting frequently touched surfaces such as doorknobs, light switches, and electronic devices, as well as items that come into direct contact with other hands. And 6. Maintain distance. Avoid close contact with people with common cold symptoms, and pay attention to social distancing, especially during peak common cold and flu season. So, when we have the common cold, how can we treat it? Treat the common cold. First of all, you need to know that the common cold has no specific treatment. In fact, the treatment of a common cold is just symptom control measures, such as if the fever is high, find ways to reduce the fever. If you feel pain, find ways to relieve the pain, etc., using certain over-the-counter medicines. Combine with rest, rehydration, etc., to let the body recover itself after a few days. However, in treating the common cold, there are some important notes. 1. Antibiotics are not effective in treating viruses. Because the common cold is caused by a virus, using antibiotics to treat the common cold is not only ineffective but also contributes to antibiotic resistance. Do not abuse antibiotics. However, in specific cases, if your doctor detects an infection or if symptoms persist and worsen, he or she may consider prescribing antibiotics to kill the bacteria caused by a secondary infection. For example, some bacterial sinus infections or bronchitis may develop after an initial viral infection, where antibiotics are needed to kill the bacteria but not the virus that causes the illness. 2. Use over-the-counter medicines responsibly and do not abuse them. Although over-the-counter medicines are common drugs, such as some pain relievers, fever reducers, etc., sold without a doctor's prescription, abuse can easily cause side effects, and the most dangerous is damaging important internal organs. Such damage may not be immediately visible but accumulates and can cause consequences that are difficult to overcome. Whenever you need to use these medications to minimize unpleasant symptoms such as pain or high fever, you should strictly follow the recommended dose clearly indicated on the package, or even seek the advice of a doctor or specialist to avoid the visible or hidden harmful effects above. 3. Stay hydrated and get enough rest. When you have a common cold, drinking enough water and getting enough rest is the key to a quick recovery, and if conditions allow, try to get plenty of sleep. All you should do now is minimize unpleasant symptoms and at the same time create conditions for your body to restore the immune system to fight disease-causing viruses naturally. 4. Limit the use of decongestant nasal sprays. Although colds often lead to an unpleasant stuffy nose and thus the need for decongestion is obvious, over-reliance on these sprays can have the opposite effect, leading to the condition. Nasal congestion gets worse after stopping use. Therefore, please use them with caution. Only when absolutely necessary. 5. Be cautious with home remedies. Although some folk remedies can be very effective and provide quick pain relief, it is important to consult your doctor or other healthcare professional before trying new treatments, especially if you have an underlying medical condition or are taking other medications. Furthermore, if you have a common cold after many days and the condition does not improve or even gets worse, quickly contact your doctor for timely, appropriate, and optimal solutions. So, a common cold, although often considered just a minor illness, can also cause significant inconveniences in work and daily activities. At the same time, inappropriate treatment, excessive use of over-the-counter medications, and especially excessive use of antibiotics for colds, often lead to many immediate and long-term consequences for the health of the patient as well as the community. Therefore, even a small illness like a common cold requires each of us to be aware of it and treat it seriously and responsibly, adhering to preventive measures and practicing the use of medicines appropriately, and researching expert advice if necessary. Wish you health. Thank you. Goodbye and see you again.